So thank you so much for joining me again for this particular episode. So for this particular one, I'm going to talk about self-care in essence, an opportunity for pharmacists to revolutionize healthcare service delivery. And the reason as to I look at it from that standpoint is one, there's a growing attention and interest in self-care, but beyond interest in self-care, there's also an opportunity where pharmacists can play a critical role in ensuring there's optimal access to quality healthcare, wellness products, and also information. And once that is achieved, then we need to see what does that look like in the healthcare service delivery model, and what role can we play moving forward? What are the opportunities and what are the prospects? And those are critical discussions to have, because there is an opportunity, and that opportunity needs to be harnessed and actually tapped into to realize results. And why am I talking about this? Beyond the dynamics and what's going on, today I had a conversation with some of my young colleagues and pharmacists in the industry, and one of the conversations we were having during the handover for the young pharmacist group leadership team was to see what opportunities are there for young pharmacists. What are the emerging trends in pharmacy practice, and what role can young pharmacists play in that space? So when you look at healthcare service delivery, and based on the principle of UHC, that is availability of services, accessibility of the services, and affordability of the same services, then we need to look at what are the healthcare services that people would need to be able to live healthy and fulfilling lives. That is one, we need the health promotion aspects and information so that they can stay healthy. We promote the health. Then we have the preventive care. Preventive care is about you avoiding diseases. When you look at it from a COVID-19 perspective, we were having masks, we are washing our hands over time and all that. Those are preventive measures to avoid being infected, to avoid acquiring the disease. We're reducing alcohol intake because of the risk to cancers, risk to other cardiovascular complications and all that. And that is evidence informed. So that is the preventive care. Then beyond preventive, in case you fall ill, you need to have access to the curative, the treatment. If I'm suffering from, let's say for example, from an infectious malaria, I need to use anti-malarials to get better. So curative, do I have the cures available? Then beyond curative, then we need to look at rehabilitative. I have a drug use problem, and therefore I need to be supported to recover from that compulsive drug use problem that is affecting me not being able to function optimally as I would have wished for. Then the last bit is the palliative. I'm suffering from a chronic condition that is an incurable, and therefore the only thing is to manage the pain so that I live a decent and actually fulfilling life for as long as I'm able to live before I take my final bow in this life. So on the look at those dynamics of it, self-care then comes in by understanding that the ultimate outcome and the quality of care that a patient receives is informed by that patient's perception. So that is customer centricity, human-centered design. Is it ideal for that person? What is the value they associate with that quality of care? So that is the role of the patient. And at the same time, as we look at that, we are in a complex world where there are so many conflicting priorities in our lives, and therefore we are looking at how best do we take charge of our life and promote autonomy in doing what we need to do where we are without having to compete and actually contend with other challenges. And one of the key challenges that people talk about when you look about healthcare is when I'm unwell, I have to go to a hospital. I'll spend probably a whole day waiting for see a physician. After seeing the physician, I'll go to the pharmacy. Probably they don't even have the medicines in that hospital, and I'll have to go to another pharmacy outside to get that medication. That is one aspect of it. Two, Dr. Google has become our best friend. And as Dr. Google becomes our best friend, Dr. Google doesn't have all the right information. And even if the right information is there, most of our patients don't know where to and how to extract that information to make informed life decisions. And the reason as to why I'm looking at this as an opportunity is the sense that with self-care movement coming up and patients gaining more prominence and advancing in their health literacy, they need somebody to support them in that journey. And that somebody who can support them in their healthcare journey is somebody that they engage with, they talk to over time in their care pathways. So that is an important bit for us to see. Where do we engage with patients? Where do they reach out to us? So that is the patient bit. Then also we need most of the products that are being used in our healthcare journey are over-the-counter medicines. And they're over-the-counter, then it means they are accessible to us when and where we need them without a prescription. Therefore, I don't need to see a physician to get medication. Let's say, for example, paracetamol. If I need paracetamol, I'll go to a pharmacy, buy it, and use it. Some of them are even now sold in kiosks and supermarkets and shops generally. So those are the kind of dynamics that we're dealing with, and that has to be addressed and have to be looked into. But when we look at the healthcare journey, we normally say pharmacies are the first point of contact, that is from a community pharmacy. I am unwell, I go to the next door pharmacy store, seek medication, seek counsel, get the medicine, and come back home. When I'm sick and I actually go to the hospital, after being seen by the physician, doing lab tests and all that, I'll go to the pharmacy to get the medication. On all that journey, the pharmacist has a critical role to play. It's a very opportune moment in the sense that pharmacist at the initial point of contact, if he's the first person that I meet, has the ability to share information with me on how to lead healthy lives, how to take my medication, how to use it well, even wellness products that I might need. That is important. So pharmacists have a role in that strategic area, and that is going to shape the future in terms of being considered as trusted allies. And we still trusted because we work in the local communities, but we can advance that trust by offering additional services from that standpoint, sharing information, giving advice on what product can be used and how they can be used, and acknowledging that beyond buying medicines from us, patients need additional support. For example, if they're using complementary medicines and traditional herbal therapies, then they need also somebody who can give them information whether those products have contraindications and have a side effect when they're used with over-the-counter medicines or other prescription medicines. So we need to take an active role. In review of literature, it's about making that literature available to patients. I know pharmacies who are running chain stores, who are having digital platforms and online pharmacies. Those online pharmacies can make use of digital information resources depending on the product that are being used. If, for example, you have patients that oftentimes order their diabetes medication on your platform, definitely you know that these patients who have diabetes and therefore they need information to lead healthy lives with those medications. So what kind of information do you need them? You have to map the client group. That would be people who are at risk of developing diabetes, people who have diabetes, people who have been living with diabetes for long, who are at risk of complications, macro and microvascular complications, whichever way they are. Then once you map your patient in that scope of group, then you now are able to see, for those who are in their early phases, or they are just diagnosed with diabetes, what is the problem? The psychological impact. Can you offer them information that is guiding them on how to deal with the condition? It's not a death sentence. How do you cope? How do I start taking my medication? When I have challenges, where do I go to? Who do I talk to? You give that information. For people who have been using their medication long term, you need to understand, are they getting better over the medication? Are they stabilized? Or are they getting worse? So that with those three baskets, again, you can see what information do I give them at what point, and how do we ensure the structured care that is continuous for them to be able to contribute to this care model, so that they are not just people who come to you for medicine, but people who trust you to give them the information. So you make it accessible on your platform, and then that's so doing, then they have the right information, and we're using the right information when they need medications. They are your clients who are going to use your medical products and going to buy from you as a pharmacist. So that is kind of developing new models of care and actually integrating yourself as a stakeholder in the community premise. That is critical for us. Then the other bit is to look at it from Selfcare is going to come up with a new areas. We'll talk about psychosocial support, additional patient-centered care, and this is an opportunity for us to offer patient services rather than just products. And that is a conversation that we need to look at. Probably I'll talk about it in the next episode, and we need to see what advances are here, what can we do better, how do we do it better. Then as the conversation is going forward, the other bit that is critical now is to ensure that we have policies that are supporting self-care. Because currently most of the care is about physician delivered. But if you're always going to depend on physicians, how do you deal with it when patients are not able to move? Will there be non-compliance, and what is the impact on the patient? How do I adopt digital technologies to support patients in their own care from wherever they are by adopting digital solutions? Do we have frameworks and guidelines on that? And that is where the policy aspect comes in. And the best way for us to shape this conversation from a pharmacy standpoint is, one, we need to look at the spectrum of services: promotive, preventive, curative, rehabilitative, and palliative. That is line number one. Then is that information available? When we talk about the information, when we talk about products, availability has to be there. Then access to there. Is it closer to the patients who need them? Can they access it legitimately from the right platform, even digital and all that? And then within our local communities, can we establish digital platform? Let's say, for example, WhatsApp groups, Facebook pages, and all that, so where we have conversation with patients and support them in their care journey. And that is now currently taking front in the sense that patient support groups are coming up and they are being actively involved in their care. So the question is, are we going to support them, or are we going to let them do everything by themselves? Because if we let them do that, then we are failing them as healthcare practitioners and players. And we are losing an opportunity to shape the future of care by pharmacists as integral players who can shape that conversation and that future together. Then ultimately, let's generate evidence by documenting the practices, documenting what's moving forward, and once we document it, then we can champion for a particular front on how we are supporting our patients and how we need to support them better so that the quality of care our patients get is optimal, is up par, and therefore we are able to grow the profession, we are able to serve our communities, and envision a new model of healthcare service delivery that is not dependent and pegged on products, but is pegged on us understanding the needs of our patients, blending that need of our patients to the quality of care and services that we have, and ensuring that it's continuous and they have autonomy to guide their own well-being and livelihoods. And in so doing, we'll have transformed healthcare practice. Thank you so much for engaging in this conversation. If you have an interest in self-care, please reach out to me on LinkedIn, Dr. Diambo David. I'll be more than glad to chat with you and share insights on how we can work together on this journey. I have an interest in it, and I'm looking at reviewing more resources, working with people who have an interest, and seeing what the future would look like if we improve on care through self-care advances. That would be critical for me, and also from a financing standpoint, how do we do that? So reach out, let's engage, and let's see how we can work on together to make that future work for all of us. Finally, if you enjoy these kind of conversations, subscribe to the channel, share it with your friends. Let's get to learn together. Let's advance the profession of pharmacy. Let's advance healthcare service delivery in the country. It can't happen unless we do it, and I'm counting on you to help me work on this together so that we see and envision that future that we all want. Thank you.